Hello, everyone, and welcome back to the HIV Prevention in Action podcast, the podcast where we have real, honest, and empowering conversations about our futures, our communities, and our realities. Today, we'll be joined by Dr. Thembi Xulu. She is a South African public health leader and chief of party for the EQUIP project, the first Africa-led and Africa-based global health consortium working across more than 10 PEPFAR-supported countries in Africa, Eastern Europe. Her work has focused on scaling up HIV and hepatitis C prevention, care, and treatment programs while strengthening healthcare systems and advancing HIV epidemic control. Throughout her leadership journey, she has overseen large-scale HIV programs, supported national HIV policy implementation. That is welcome, Dr. Xulu.
I'm good, Cwayita. Thank you so much for having me. I'm currently the CEO of the South African National AIDS Council, and I am also the chairperson of the Global Fund Country Coordinating Mechanism in South Africa. So my EQUIP job ended in 2020. So I'm here from that capacity. Thank you.
Okay. I loved how you said, actually, I just got better. I love that. Can you just please tell us about yourself and your journey into healthcare programs like HIV and leadership?
All right. So essentially, I'm just a girl from Guamashu, who was raised by her grandmothers. And they were both very sickly. I remember when I was in primary school, I used to take time off to take them to King Edward Hospital to get their chronic meds. And one of them had arthritis. And I used to always say, Granny, one day I'm going to fix you. So I've always been a nurturer at heart. And that's how I knew I would get into health. But at that time, I didn't know I was going to be a doctor. I'm also a mother to two young girls. AGYW, so one is 18, one is 24. So these health matters are close to my heart. So when I eventually decided to go to medical school, I did a diploma in obstetrics and gynecology. And the push for me was how I saw how pregnant mothers were unwillingly transmitting HIV to their unborn babies, because it was in the 1990s or, early 2000s where treatment was not available. So that was my interest. I then joined the perinatal HIV research unit, where I worked on TB prevention in patients living with HIV, so trying out new TB drugs. But that's where I also got to work on some of the studies that were then funded by Elizabeth Glazier. So I joined the perinatal HIV research unit as a clinical investigator, doing research on TB and HIV. And at that time, my focus was really on preventing the TB morbidity and mortality that we are seeing in people living with HIV, mainly due to lack of access to antiretroviral therapy. And that was around 2002, 2003. And then 2004, the government program started on HIV treatment. I was then appointed at Right to Care to essentially be the HIV treatment specialist, teaching doctors and nurses on how to treat patients with ARVs. And at that point, we had the very difficult drugs, the ones that were causing bad side effects. But there was a particular fear of treating children amongst clinicians. So I got into that. But at some point, I decided I am meant more than to make a difference one-on-one, but to make a difference at a public health level. So I did a master's in public health, specialized in health management and health policy, and I knew that I was growing to become somebody that would write national strategies and guide country direction in terms of us actually reaching the targets that we have towards 2030. So that's how I moved from being a clinician to now somebody that writes the national strategic plan for the country.
Wow. I think I like how you say that you knew and you just didn't even think twice. You just continued. You just continued until you got to where you wanted to be. That amount of drive is amazing, and it's beautiful to see, even as for me as a young person. So can you please just explain to us, because you've worked in this space for a number of years, why is youth participation important in HIV prevention conversations today?
Youth participation is important, I think, as policy makers or as people that sit with policymakers. The voice of young people is not always at the table. And the lived experiences of youth is what we need to take into consideration when we make these decisions and make these policies. And I have sat with young people in many conversations where I'm quite aware that sometimes the decisions that we make don't quite resonate with our young people. And that is why at some point, through the multi-stakeholder coordination body called SANAC, which I lead, we developed the Zikhala Kanjani youth strategy, because it's not just about appealing to youth, but it's about using language that they understand, that they want, but about making sure that services are accessible to youth, that the services provide them with respect, but then that they also have agency, that they are able, for instance, to have access to choice. And choice is not just about options. It's also about agency of young people, not just having a seat at the table, but having a voice at the table. For me, we keep saying youth are the leaders of the future.
Yes.
The truth is, the future is now. The future is now. We are having to move in a direction where we know that young people are severely affected, and not just in terms of the burden of prevalence, but also incidence, which is new infections. And we can't move on without having the voice of youth being significantly heard and responded to if we are going to be successful in the fight against HIV, TB, and STD.
Yeah, that's true, because most of the things that get spoken about in those tables, the conversations are about us. And at the end of the day, our voices need to be heard so that the right decisions are made. So can you please tell us, how do decisions made by the leadership and policy level affect young ordinary people accessing healthcare services?
I think we've seen some good change, especially when you look at how the government has responded with youth zones and youth-friendly services, how some of the community-led models are very much youth-led and youth-focused. And I think also how some of the strategies that we've developed have not necessarily been led by us, but in SANAC, for instance, we have something called a youth sector. And that youth sector then sits together. There's a multi-stakeholder consultation. All the provinces, districts, private sector, civil society come together, and they say, from a youth perspective, this is what we would like to see. Actually, this is our understanding of our challenges. So in responding to those challenges, it's amazing how sometimes, Cwayita, we think we've got problems and we don't know the answers to the problems, and yet the solutions are sitting with the young people. So that is what I have enjoyed, to say the answers are in the young people. And just to give an example of a discussion I was in, I think I was in a room, and probably Yvette was in that same room. And we were talking about these community models, and how we want, for instance, access to PrEP for young people, and not so much to make it a medical solution, but make it one that is accessible at the community level. And one of the young people who was in the room said, we love the idea of community, but if, for instance, a community approach is a church, for instance, for PrEP, I might not go there. So, even within the considerations of youth, there are deeper things that you need to dig into to understand. As much as you are saying involve community, make community services more available, it still has to be relevant to the type of youth audience that you are dealing with. So that's where it becomes important, because we have a specific target, which is youth, that we would like to reach, that an epidemic that we'd like to turn around, and youth are most affected. And if we are going to make a difference, we really need to hear them from all perspectives. And it's not going to be even one size fits all, even for all youth. It's not going to be one size fits all, because our youth are different. And what I would say we normally refer to as maybe sometimes what we would refer to as reckless behavior, or maybe youth wanting access to a cell phone. Sometimes it's from a point of desperation, and needing, some sort of financial support or financial economic development of sorts. So those are the things we need to be thinking about. And those are the solutions that I'm saying are coming through from young people. as we talk to them. Hence, you'll see the transformation that has occurred over the years in some of the programs.
I love how even with your example, you are taking such a basic question. You're not saying this young person was asking a very smart and technical question. They were just asking a question that this is a situation that we will face on a daily. What must we do? And you've done work across different countries. What are the common HIV prevention challenges that young people are facing on top of the one that you've just mentioned?
I think it's especially in the regions where I've worked. Young people belong to families, they belong to communities, they belong to societies. So the first issue is that there are issues that relate to upbringing, to poverty, to inequality, to issues of nutrition, and just to basic needs and even access to education. And those then might expose you to certain decisions that you make because you are trying to make your situation better. And it's a common challenge, especially in the SADC region where I've worked, where young people find themselves having to make decisions for survival that might end up impacting their health negatively. So that is a common problem, and a lot of it rides on to what I was mentioning, where economic opportunities need to be created to allow them some sort of independence and ability to drive the sort of quality decisions that they want to make about their lives. Ooh, this thing is letting me down here.
Okay, Dr. Thembi, please tell us, through your work across different countries, what common HIV prevention challenges affect young people that you've observed?
All right, thanks. So young people, as I mentioned, are a product of a community, family, and a society. And there are obviously many structural factors that shape already the kind of environment that you grow up with. And those kind of issues normally drive young people to make certain decisions, as I was saying just now. There are other structural and deeper social cultural issues that affect young people that I said sometimes make them end up making risky choices. Young people find themselves in scenarios where when they are not having enough support, for instance, in terms of their economic needs, all they need, as I said, is basic survival strategies. And this is common across the SADC countries where I've worked. And whether it's a stigma when you go to a health care service, or issues related to just access to basic sanitation, like needing sanitary pads as a young woman. And I was saying that a meaningful response really requires that when we tackle these issues, we've really learned that it does require expanding the economic empowerment opportunities for young girls, and this is across. It also means strengthening and retaining them in education, because we've seen that school has a protective factor for young girls. It means addressing issues of gender-based violence. When we talk about this issue of the new HIV infections, teenage pregnancy, and gender-based violence, as a concern for young people, it requires us to address issues of GBV, which means we must make sure that these youth-friendly services are not just at facility level, but closer to them, where they can access them safely without stigma, including access to HIV prevention options. So this is what I've tended to generally see, that it's not just a medical issue, but there is a community issue, but other social and structural drivers that young people face in general, where opportunities are limited. It's very difficult for them to be responsible for the decisions that they make. Hence, we label their behavior risky. In many instances, it's just a survival.
Sure, I loved how you highlighted the importance of survival. Sometimes people will really just be depressed and they're not able to just get out of bed, and the only thing that they're hearing is take PrEP, and sometimes that's not like the way to go, especially being a young person. So can you please just tell us, why does stigma and misinformation continue to affect prevention uptake among young people?
All right, so I think it's important that the message on stigma and misinformation itself is led by young people themselves. So you'll find that in a lot of cases, whether it's the policies or the strategies might not necessarily be drafted by them. And when it's put across, they don't quite understand it. And as such, it's difficult for them to make sense of the message. So as I said, my preference is that when we are addressing issues of stigma and misinformation, we sit with young people in the room, we let them define what is their experience of stigma first, and then we let them say, what is it that they don't understand? So that is what we are responding to. Because they've got other vulnerabilities, which lead to financial dependence, like I was saying. And even issues of unemployment, Cwayita, like I was saying, can contribute to the hopelessness that you were talking about. Mental health challenges are a real thing. And the misinformation really comes from the fact that I think we have not always taken them along as we develop strategies to try to respond to some of the issues that affect young people. Therefore, you'll note that now in our approaches, we are quite driven in terms of making sure that young people are leading in terms of defining the problem, their experience, but also helping us to define the solutions and also, to identify what could be the risks and how could we mitigate those risks, because their lived experience is not ours, even though we might be sitting at a boardroom and making certain decisions. So, and it's ultimately about not just PrEP, but PrEP as in the bigger socio-cultural context, but also options, making sure that it's available, and ultimately, sometimes going back to the basics, Cwayita, where, ABC was abstain, be faithful, condomize. We still know that today condoms are the single most cost-effective intervention, and not every young person wants to take a pill on the daily. Not every young person might want to be injected. So those options are important. And these are the discussions that we need to be having with young people, and for them to not just be beneficiaries, but for them to be sitting at the table, as I said, not just have a seat, but to have a voice. And because we need them to then lead the messaging, that is what will kill the misinformation, when they are informed properly. And the only way that happens is when they are part of the conversation from inception. We don't bring them along at the end. We don't say, oh no, we consulted young people. We say we started with them.
Wow, I think I love that. And I think that's like the first step to becoming a change maker. You identify a problem and you need to find a solution to it. And I love that you are mentioning that we have to get these young people to bring out their own solutions, because at the end of the day, they will be left with the consequences of whatever choices anyone else takes about their lives. So what do you think are the gaps that still exist between healthcare systems and the realities that young people face today?
I think you've touched on matter that's essentially not been expanded but more exposed by the financial situation that we're finding ourselves in, with our donors pulling out. Our donors have traditionally, funded many HIV prevention programs that were community-based, and young people felt more comfortable, being attended to at those particular facilities. And we are finding now, for instance, that access to services, prevention services at community level, is an area that requires attention. And that's one of the areas that we are starting to focus on in terms of how do we make things like social contracting better. And social contracting means that youth organizations have to be empowered, Cwayita. And when I say empowered, I don't mean technically. Technically, I think young people, they know what their problems are, but they need to be empowered administratively. When you are running an organization and you are applying for a grant, what does that look like? What does accountability look like? It's really important that we empower our young people, we develop their skills, we open up entrepreneurship opportunities, but at the same time, we provide them these access to prevention services in areas that make sense to them and are more comfortable to them to access. And as I said, it speaks to the inability to divorce health and economic and other vulnerabilities. And that is why we need them at the table.
Yeah. So Dr. Xulu, right? I know that most of the young people want the clinics to be safer and more welcoming, but I think most of us, we don't know what really it is that we want, because we don't know how it is. Like, we don't know what the bigger picture looks like. And since you have been to different countries and you've obviously visited a number of clinics in your journey, do you perhaps know of one that absolutely wowed you, and what wowed you about that clinic that made it safer and more friendly for youth, so that someone else who's listening, who's a health practitioner, can take some tips? Maybe even if it's a country in Europe, you're just like, oh, I loved this, maybe we can adopt this in South Africa.
I think without being specific, maybe I'll explain what I would like to see as ideal, rather than to name a clinic that I saw in Ukraine or in Myanmar in my past life. I think what I would love to see being ideal, Cwayita, is a situation where young people get access from services that are youth friendly, offered by other young people that have got the lived experience, that those services are integrated, because integration means that you are not moved from pillar to post, that for this go here, for this go there, for this go there. But integration from our perspective as from government and from other policy writers, etc., it means there are efficiencies that we gain within the system, but it also means we are able to take that money and reinvest it based on the financial situation that we find ourselves in. So a situation where young people are able to get integrated services in a comfortable environment where they can be free, not just in terms of requesting the number of condoms, but accessing PrEP, but also being free to talk about mental health challenges, but also being able to interact with each other. Because I honestly think, as much as I'm a mother to an 18-year-old and a 24-year-old, there are things that they will never say to me, but that they will say to their peers. So a model that allows young people to lead for young people services, with obviously some kind of oversight and guidance and support available in case a support is needed. But I honestly think it works better when it's integrated, it's youth friendly, it's led by the youth themselves, because then it really takes away, and I don't like this word because I'm over 50, it takes away the ageism factor that we've been blamed for. That we are very old school, we are very old school in our approach, and there are better and newer ways of doing things. But there's no doubt, Cwayita, that there's a role for us that have been in the system to teach the young people, but for them to help us modify it in order for it to be responsive to their particular needs, which we might not understand. So my ideal situation is an integrated service that is easily accessible. Because, when I say easily accessible, the service itself might be free. But if getting to the service costs you money and you don't have the money, that is not what we're talking about. So it's a mixture of issues, like I was saying, one that even allows you, economic entrepreneurship support, so that you are able to sustain yourself, to survive, and to access that within your communities, but to have the support of your peers that you trust.
Yeah. Wow. I actually want to go to that clinic. I actually want to go to that clinic because it is interesting. It makes me want to speak to someone that is my age. Wow. Okay. So what role do you think young people should play in shaping the future of HIV prevention programs and policies?
All right. So I think when you look at, and maybe I'll just take a few of the building blocks of the WHO, because that's what they use to define health systems. When it comes, for instance, to technology, right? Let me just, because that's the latest AI, TikTok, etc. I think our young people need to be open to being given correct information, and then for them to be utilized as agents of change, as you were saying, based on their ability to access their counterparts in masses that we could never be able to do, through platforms that we might not be able to do, but for them to take the lead in terms of how the response is shaped in order for it to meet their needs, like I was saying. So I'd love for young people to not sit back and wait for services to be brought to them. But I'd love for them to be advocating, for instance, for things like, how do I access my pap smear results like I got my results during COVID? You know, during COVID, we would all get SMSs on a daily basis. So when you've done a pap smear, Cwayita, or whoever, if those results come to your cell phone, you know, I would love young people to be advocating for a situation where we go back to that scenario. And once a result comes to your phone, there's no way you're going to sit back and say, no, I'm waiting for a call from the clinic to say your results are back. Or when you get to the clinic, then they tell you your results are lost. You get there and you say, I see there's a problem with this result. Based on this, I'm here to actually request or demand a service based on what I've seen. And then for the young people to take that information and use that to empower their peers, because we've got many young people that don't necessarily have access to the same forms of AI, whether they listen to community radio stations or they've got access to other media. But young people should be leading in those platforms in terms of sharing the correct information and bringing our young people closer in terms of how we respond as a multi-stakeholder body. Like I said, SANAC is chaired by the Deputy President. We've got civil society, we've got private sector, we've got all the government departments, we've got development partners, we've got labor. So having a stronger voice, but being willing to be educated so that when you use that stronger voice to advocate, it's based on information that is scientifically based and is really research-based and proven. And we really rely on young people to help us to reach other young people. I think that's the only way we are going to start seeing a reduction in the new infections, especially amongst our youth.
I must say, I absolutely love your ideas. You have such innovative ideas, and I think young people should just take a page from your book. I would love to hear many of those. So because you have such great hope for the young people in our country and such great ideas for them, what gives you that hope? What makes you think this is possible?
All right, I'll be honest. I mentioned earlier that I'm a mother to two young girls, adolescents and young girls, 18 and 24. So there is obviously an element of it being personal, because here I am with young girls that are starting to get into relationships. You know, there's sex talk, etc., etc. But I have seen what happens, Cwayita, when young people lack access to economic opportunities.
Yeah. Wow. Not just leading them, but guiding them to lead. Wow. Okay. So I was going to ask you, what message would you like young listeners to leave with today? And I'm just like, but that's the message. But do you want to give us a message for today? Wow. Okay. Thank you so much. Dr. Xulu, thank you so much for sharing your experience in leadership with us and for encouraging us as young people to use our voices to be at the tables, but also be loud about the tables that we are in and find the solutions to our own problems. Thank you so much for joining us. Listeners, thank you so much, guys, for listening to our episode. Remember, I'm Cwayita Jemsana. Thank you so much for joining us. If you have any questions, drop them down in our comment section, in our social media pages. And always share these videos with your friends and your family members. Thank you. Bye.